Hi, welcome to Skeptic Hangout, the place where we sit back, relax, and chit chat about intriguing and sometimes controversial topics through the lens of skepticism. We are Josh, Richard, and Laura, and today we are discussing cosmetic surgery. So grab your English tea or your fat free, sugar free, caffeine free coffee and join us as we talk about the nip and the tuck. This is Skeptic Hangout, cosmetic surgery. Dude, I almost said cosmic surgery both times. That was an incredible challenge for me.
I like the idea of cosmic boob jobs. Like I'm all for that.
Dude, cosmic surgery is right up there.
They're shooting lasers out at you. Actually, that's pretty sexy. I hope somebody's gonna do that surgery. Just like poo poo poo. It has to make those sound effects too, because that's sensual for me.
Yeah.
like that's what everybody thinks about. Well, maybe I'm speaking for too many people when I say everybody, but that's
like
where my brain
that yeah.
My brain goes for cosmetic surgery. You got it in my head now. Is boob jobs, probably because that's the one that I've known the most people that have taken part in is they've had enlarged breasts, and that used to be kind of a frowned upon thing, but I think culture's changing the way we think about that. Like we're all about body positivity. If that's what makes a woman feel better about herself, why are we mocking her? Why are we calling her a bimbo for taking care of like her insecurities or something like that? And I'm not just saying that because I think they look better than they used to back in the 80s, but like the surgery has definitely changed to the point where like, I don't think there's anything wrong with cosmetic surgery. Like there's that whole idea in the culture where it's like like just getting the facelifts and like tummy tuck and all that kind of stuff is just vapid bimbo stuff, and I don't think that's the way culture is looking at it anymore. I think things are starting to change for the better, and that's just in the superficial areas of cosmetic surgery. It goes way beyond just like the superficial.
Oh yeah, so I think we're definitely going to get into other topics besides just what you're talking about, like boob jobs or like a little bit of facelift or like a tummy tuck or something. But to your point, I completely agree with you. There's this perception for the longest time that if you're getting a boob job or something, you must be a porn star or something like that. And even that, I don't have a problem with. If you're a porn star and you get a boob job, like fantastic. Like I don't even have a problem with that.
Think
But
you
it
can
was
write it
kind of
off on
like
your
presented
taxes.
as what's that?
I think you can write it off on your taxes now.
Yeah, I mean, seriously, like I wouldn't have even had a problem with it if that's the only reason. But two of my close friends have both had boob jobs. One was to replace her breasts after breast cancer, and the other one was because she was just an incredibly underdeveloped person and had really low self-esteem because she was commonly like called a boy and teased about it and stuff. And the boob job she got was beautiful, by the way. Like she got C's, she didn't get anything outrageous. Um,
That
but
seems to be the popular one.
she gave herself just an average chest to look normal so that she would stop being harassed and teased about being flat chested. And so when we think about cosmetic surgery in terms of the taboo side of it, we fail to see that like even when people do get it strictly for cosmetic reasons, it can be for psychological reasons that they're dealing with that you don't even understand, right? And it may have nothing to do with something as vain as, oh, I just want big boobs, which even
And
that,
there's nothing wrong with
if
that.
it's right, if it's just vanity, I think it's still okay. But I think in very few cases is that the actual reason.
Yeah, and of course, cosmetic surgery on the breast isn't just implants to get bigger boobs. I know someone who got breast reductions because they were uncomfortable for them.
Yes.
I don't think about those as much, but yeah, that definitely is a thing, and there's nothing wrong with that either. Like, we as a culture, we constantly are like making fun of, and this still happens despite the fact that culture is changing for like people in the real world. I think I still see people constantly making fun of celebrities that are doing it, and this is where I'm starting to change my view on celebrity, and where there's a lot of pressure on them to look a certain way. Like they have their own troubles. Yes, they have money. Money's not one of their problems, but they have their own problems of like trying to keep themselves looking youthful and stuff like that, especially women celebrities. and occasionally they end up looking a little bit plastic, and that used to be something that like even I would make fun of, which I'm trying my best to back off on, because
Yeah.
what they're trying to do is like stay in the career, and especially women are very much get roles based upon their looks, because of the movie system still needs a lot of work to do, even despite the fact that we've been moving forward a couple steps after Me Too. We haven't gone all the way up the stairs yet.
Yeah, you bring up a good point when you say start to look like plastic, right? Because there are times where when someone gets cosmetic surgery that it's just apparent that they've gotten surgery. It either doesn't look the way that we perceive beauty to be. And I say we because
It
we
changes
presume that because it
culturally.
looks plastic or because it looks fake, that they didn't deliberately want it that way, that it was somehow like a mess up or a screw up, right? But we're talking about fashion preferences, and I've watched documentaries with women who that was the exact look that they were going for because that's what they wanted, right? And so we kind of take for granted the idea that like, oh, this woman got so much cosmetic surgery that now her face is screwed up and she looks fake, right? And we take for granted that maybe we're applying our own beauty standards to somebody without fully understanding what their own personal beauty standards are,
Well,
right?
it also could be like they're falling for societal pressures, like that are
Yeah.
telling them that they have to look a certain way,
Yeah.
and when they'd be perfectly fine without all that kind of surgery. Because I've definitely seen some who have aged more gracefully than others without it, but also they might just not have very obvious surgery, because maybe they have very minor issues with how they look.
Yeah, like there was the girl from Dirty Dancing, and right now her name just escapes my head. But people used to make fun of her for her nose, right?
They used to
Very
always put her in the corner too.
always putting her in the corner. Yeah. Well, she went and got a nose job, and I thought she was beautiful and cute the way that she was, and she's beautiful even with her nose job. But I can't imagine being in that position where I'm in the limelight, right? Like where I'm in front of people and people are talking about me, and all I hear them talking about is how my nose looks or how my ears looks or some arbitrary beauty standard that I don't quite adhere to. Like that would probably crush me. Like I've got a pretty fragile ego. And so I can only imagine that celebrities they probably have a bit tougher skin than I do because 'cause they're more used to it, but that doesn't mean they're not human, right?
I don't know. I hear a lot of interviews with them, because podcasting is what I can listen to for 8 hours a day at work. And like, it sounds like I don't think they have tougher skin. I just think that that's the image that they're
Right.
supposed to give off. But
Yeah.
besides the celebrity area, there's like people, another area of plastic surgery is like people that have had a horrible injuries, or like burns or something like that. That's another important area of plastic surgery that almost always gets overlooked when you first talk about it, because everybody goes to like the glamorous side, just like I pushed us into
I
it
was
when
about
we
to say
first
like
got
you,
into it.
Josh.
I mean,
Yeah,
I honestly, I'd rather talk about boobs than burns. So that's why my brain went there, because burns gross me out. So yeah.
and I think cosmetic surgery, and I don't know whether how accurate this is, but certainly the accounts of cosmetic surgery, the earliest accounts that I've seen, have been because of defects, for want of a better word.
Right.
Whether the ones that you're born with or ones that you've like been injured during war and
Mhm.
things like that. There was I think she was French lady who made replacement like face parts out of wax
Mm.
and put them on people, and that's going back way back.
Oh, that's
And
interesting though.
for people who kind of I think, now, I may get this wrong because I've it's not something that I've like read up on. It's something I've seen in passing. But I think they were for people who were kind of injured in wars and things,
Oh, okay.
and she made prosthetics for, and that was the first account that I'd heard of cosmetic surgery coming into play.
Well, now, yeah, talk about injury, but there's also like birth defects. I know one of the most common ones that we take completely for granted in our culture today, but that in cultures that don't have as much medical access, that it's very important to get doctors over who can do that is cleft palate surgery.
Yeah,
It's very, very common and it's very important to get it fixed. Like there's actual like quality of life issues that come up if it's not fixed. And so when we think of cosmetic surgery, we kind of take for granted that is something that it's not just about like, well, I want to look better or look normal. When you think of like someone who's born with a defect, it's how does it impact their ability to do things like eat or breathe or have a standard of living, you know?
And would there be like cultural cosmetic surgery too? Because I would say like circumcision is more of a, like a
Yeah.
cosmetic surgery area. That's because
Yeah.
it's definitely elective. I don't know if they would get necessarily a cosmetic surgeon or what that specializes it, but it's definitely, I'd count that as unnecessary cosmetic surgery that's just been brought about culturally. And I'm sure there's other kinds of examples of just cultural cosmetic surgery.
100%. Yeah. I'm glad you brought up circumcision because I wouldn't have even thought about it, but it is absolutely a form of cosmetic surgery. You're altering the look of the person's body by either adding or removing something to it, in this case, removing. And it does have really nothing more than a cosmetic effect. Like, I know there's a lot of people who are like, well, it's easier to keep clean, blah, 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 blah. If you look at the science today, a lot of people are saying it's actually healthier to have the foreskin still on and that it's completely unnecessary to remove it. So a lot of the excuses that are quote unquote medical don't even really hold up. So yeah, that's really interesting. That brings up a good question though, is like we talk about surgery that's either elective because it makes the person feel better or it does something for the person, or surgery that's to correct an issue. But what about things like that? Surgeries that end up having a negative impact on the person or are culturally kind of put upon the person that might actually cause them harm. And like the circumcision and female genital mutilation. I guess both are forms of genital
That's
mutilation, but
the one's more
um,
barbaric because it's more
Yeah.
serious on what it does for sexual stimulation in the future.
right. Yeah. So what do you guys think about that in terms of, because I would, without even thinking about that, I would have said like, yeah, I'm all for cosmetic surgery. I don't have any issues with it. I guess up to each person. But when you brought up circumcision, my brain snapped 180
But
and I was like, well, let's look at a different angle and let's talk about that for a little while.
Well,
that's a very
there,
good question because some people will, like, say for example, somebody converts to Islam
Yeah.
and they've not been circumcised. They may choose to get a circumcision because of the rules around it in Islam.
Yeah.
But then again, of course, the vast majority of people are just. I think it comes down to choice. Is essentially what I'm saying.
Yeah.
If you want to go and have that done, then that's fine.
well,
That's a free
consent
choice
as an
you're
adult.
making. But for forcing it on people because it's a dictate to do so, that's where it becomes very, very sketchy.
Like the circumcision thing, like I have a hard time taking a hard stance on this either way. Like in my brain, logically, I think that it's definitely an unnecessary surgery. But I most of the women that I've been with prefer circumcising. I know it's a
Because it's
cultural
cultural.
thing.
It's a
Yeah,
cultural preference that
yeah,
we're
it's a
taught
cultural
from.
thing, and it was
Yeah.
happened to me. And like, if it hadn't happened to me, I'd be upset that I could remember actually having consent and do it. Now I have no memory. It's just the way my penis is. But I wonder, just because the way that culture is, whether they're saving the baby by taking care of it, or if they're taking mutilation. I really have a hard stance on it. Like logically, I'd say that it's wrong, but then emotionally, I feel like it was the right choice for me, and I was glad that it happened. But you can look at that with hindsight and say that's why I'm okay with it. But if the culture were to change, I think that would be for the better and become completely unnecessary.
Yeah, and so it's interesting when you talk about harm and like, well, I don't think of any harm that I've experienced because of it, or if he has a choice, it's perfectly okay. But there's this thing with compulsion, right? Where it's compulsory because there's a cultural pressure. So it's really hard to say whether or not the person actually wanted it or not, or would have wanted it in a different circumstance or not. And so I have to think outside of like our sort of European American cultural perspective. There is a tribe, and I can't remember where they're located, so I'm not even gonna try and guess because I know I'll be wrong. If I can find it, then I'll put it up on the Facebook chat. But there's a tribe where there's a female beauty standard to chisel their teeth into like sharp points. And now we from our perspective can be like, oh, that's gross, that's disgusting, that's not beautiful. But from their perspective, there's a beauty standard there. And the women who do that, they undergo pain just like anyone else who undergoes cosmetic surgery, right? And they undergo the healing process. It's something that they do voluntarily, but once they get their teeth chiseled, it's like a clock starts, and they know that eventually their teeth are gonna die and fall out,
Oh,
like, they're gonna start losing their teeth. But they do it because they want to maintain that beauty standard while they're young, even though they know that as they start to age, they're gonna have really bad teeth problems. Um, My
And
question
they
is,
don't
and
have
this
chiseled dentures they can throw in there afterwards.
right? No, yeah. Well, I mean, it depends on how much exposure to to medicine they have, right? And in the case of this particular tribe, very, very little.
That
But
sucks.
no, I think it goes along the same lines as circumcision, where it might seem like that adult male who converted made the choice, but there is what they're doing harmful in the long run? And is it so and now you can start to apply it to every beauty standard. You can start to apply it to boob jobs. You can start to apply it to facelifts, right? There's a risk involved. There can be infections. There can be problems. And so, yes, I think it should be a person's choice, but I also think that there's a lot of cultural pressure that goes into making those choices. And then I have to kind of question that. Like, is that something that person really truly wants because of who they are inherently, or is there some sort of compulsion there? And does that make that act just a little bit more uncomfortable for me to think about in terms of like I would never say she's not allowed to get her teeth chiseled, but I would say, yeah, but there's a lot of cultural pressure there that tells her that that's something she wants to do to look pretty, right?
But then again, we are all byproducts of cultural pressure. Like
All of us.
I don't think you
Yeah.
can say anybody is any certain way inherently because we're all products of what's
Right.
around us.
The nature
So
nurture argument.
so
Yeah.
I don't know if that takes anything off of it. Like the fact that you feel it. It doesn't matter where the feelings came from. I would
Yeah.
like people to apply less horrible standards or high standards to people. I mean, you can't all look like this. I don't expect anybody to, but I think that we gotta back off the pressure, but still recognize that there are cultural significance to the way everybody looks and what is appreciated as a beauty standard, and understand that no matter how far we go, there's probably always going to be some social pressures to look a certain way, and everybody and cosmetic surgery is only going to get easier and easier and probably better, I assume. So more people are going to want to take advantage of it the further advanced surgery becomes.
I don't know. It's one of those funny things, that isn't it? I think I always try and think about myself when I think about other things like that, and I do, when I was training, that hurt the fuck out of my body,
Right.
but I
Yeah.
enjoyed doing it.
Mhm.
I really enjoyed doing it, and it was uncomfortable. Like when I was wrestling, sometimes I'd go to bed crying at night because I had that much back pain. But I loved doing it, and it made me feel good, even though it hurt, even though it was uncomfortable. So,
Yeah.
is that the same for these cosmetic standards in these other cultures? That to them is culturally acceptable. I think we've got to be careful looking in from the outside to say,
Absolutely.
this is, oh, you know, that but, because they are those cultural standards. And if they're doing it by choice and it's not being forced upon them, and of course there's an argument about, well, what is choice if it's a cultural acceptable thing. But if they're kind of going into it willingly,
Yeah.
then who are we to say, you shouldn't be doing that? I think as with everything, uh, when if we come into contact with those people, rather than looking from afar and saying you shouldn't do that, if we
Right.
come into the contact, conversations and education is fine, and they might educate us on things, we might educate them on things, and that interaction will give us, a like we talked about the last episode, kind of cultural diffusion and
Mhm.
sharing of ideas. And that's not to say one thing is bad and one thing is good, but to like just share and learn together.
That's exactly why I asked the question because it's interesting. We see what other people do as barbaric and they might see what we do as barbaric, right? And there is this sort of distinction between how much is cultural pressure and how much isn't. And I agree with Josh, like everything really comes down to some sort of cultural pressure at some point or another, right? Because even the friend of mine who got a boob job because she was tired of being teased, that was cultural pressure, right? Like she wanted to conform enough to where she's basically just left alone, right? Just to blend in. Um, so that is a really, really good point. It's interesting because, we might look at something like teeth chiseling and be like, "Wow, that's barbaric. How can that be considered a beauty standard?" And yet we stretch our ears or we get tattoos, um, or we get, like whole chunks of our stomach sucked out of ourselves with a tube, and like, like we get that's a pretty drastic thing that we'll do to ourselves. Um, so it's interesting what we consider acceptable or normal and what we consider to be extreme or grotesque or whatever. I ultimately agree with both of you that if a person wants to do something to alter their own body, they have a right to do something to alter their own body. And I
It's
also
really. Sorry, go on.
no, I was
Sorry,
gonna say I
finish.
also agree that relaxing beauty standards across cultures would make people maybe make decisions based more on what they want and less on like to make somebody else happy. But yeah, go ahead.
It's really funny how these things kind of work, because I remember pre-COVID, before me getting COVID in
Mhm.
November 2020, and the kind of exercise and the level of exercise I did. And since not doing that, I've got a little bit of a belly developing. Uh, or some would say I have had a belly develop. And as my daughter comes up to me and pats me like lovingly, affectionately, and calls me fat piggy daddy. Uh,
Oh,
but I've noticed, and people who I know have commented on that. And to me, it doesn't matter. I don't care about it. But to some people, that's a massive, massive thing. And that would cause great big kind of like insecurities and a drive to kind of regain the former body. And it's interesting how that can be seen as kind of a positive thing to do. That pressure, that cultural pressure, is positive
even
because
though
it fits into
psychologically
the
it could be worse on someone than just
yeah,
getting some sort of
because
body
it fits into the
modification. Yeah.
cultural norm,
Yeah.
like you were saying with your friend with the boob job. And yet other things can be seen as negative because it's a cultural pressure.
There's also like more personal pressures. Like if a woman's dating a guy that's like constantly hammering her up to get bigger boobs, I think everybody would say that was a
Yeah.
negative right there. Like
Yeah.
she was pressured into it, but it is, she still could just have the society pressure, and like we're not happy that the society's pressure is on her, but we'd still like say that was still more her decision. She had more agency in it than if her boyfriend is the one that's like constantly saying, "Hey, you look good with D's all the time." Like there's somehow a negativity when it's more. And I agree with this. There's more negativity when it's from somebody that you know and somebody that you are
And it's direct.
actively trying to gain approval of or keep approval of, because that could be like if she doesn't get the boob job, she could think that he's going to leave her for a woman with bigger breasts because he's constantly bringing it up. It's obviously something that he wants her to do, and that's when it's really fucking negative and toxic.
Okay, so now I have a question because we see other people treating each other badly and we're really really comfortable pointing that out and saying like that's abusive or that's wrong behavior, right? But it becomes more tricky when it's that same thing, that same exact you should do this, you need to do that, you need to look better with this and you'd look better if you just lost 10 pounds when it's coming from the individual's own mind, right? We fail to see that as being abusive. And I have come recently to understand that like some of my negative beauty standards that I have against myself can be a form of abuse because it makes me feel just as bad about myself as if it was coming from someone on the outside, maybe even worse, right? And so now it gets tricky because I do agree that someone should be able to get whatever body modifications they want, especially to feel better about themselves. But then if you're talking about like, well, it's bad for a person to get a boob job, for example, just because their boyfriend is putting pressure on them to look a certain way, what do we think about and what can we do about when it's their own voice in their head saying, "Well, you'll only be pretty if you have double Ds," or "You'll only be pretty if you get that tummy tuck or get liposuction," right? If it was coming from the outside, we'd see that behavior as abusive. But how do we address it or think about it when it's coming from the inside?
I don't have a problem with somebody like, I think those kinds of thoughts are toxic, and I definitely would say therapy is needed. But I
Yeah.
also see in the surgery may not be the one all solution that they think it is. They may find other problems elsewhere. I would say I'd push for therapy, and then if after they've done therapy they still want to get the surgery, if it's that toxic, if it's not like I just want pectorals that look like Sylvester Stallone or something like that. I don't really have negative body image, but like I'm a huge fan of Sylvester Stallone, so I might want to do that one day. I would find that completely positive coming from me. No therapy needed. But if I had like a really negative outlook on myself, which I don't, I could say therapy and then maybe go ahead and get the Stallone pecs.
Yeah, make education available. I
Mhm.
think that's a because I agree with Josh about therapy, but I think the problem is if you're not aware that you need therapy, it's going to be hard to go and get therapy.
Or don't know how
So
to access it.
yeah, education, more government funds into education to let people know that it is okay to talk and it is okay to be uncomfortable and to approach people when you're uncomfortable and to seek therapy to begin with. The government I think has a responsibility to do that. So the mental health is as important as physical health, and the governments place a lot of onus on the kind of physical health, but not so much on mental health.
Right.
And start for the governments, they need to, I think, start widening health to include mental health a lot more, and not in a kind of uh like just to say, in a token way, just to say, look, we're doing, because you see that quite a lot. Oh, mental health is really important to us.
Oh, yeah.
Make sure your mental health is up to standard. But then not having anything anywhere where anyone can access mental health services.
Yeah.
You know, uh, invest in education and invest in these services so people have got access to that therapy. And I think that will always go a long way to kind of improving health. It's mental health. I see mental health now very much like kind of physical health was 100 years ago, where it needs to be something where uh, there's a lot more awareness about it being raised, and it happened in the 19 kind of 50s and stuff, 1940s, 1950s, where there was a big move on healthy body and
Yeah.
get yourself into shape and all this kind of stuff. We need that now for mental health.
Oh,
Where
absolutely.
was that government incentive for mental health?
Well,
It's
we
going
don't.
to help them as much as it helps the individual. A healthy society is going to be a better society for all.
Yeah, I love how we're able to tie this into more than just the superficial conversation about cosmetic surgery and into something a little bit deeper, like the whys and when is it okay and not okay and stuff like that. Because I think that those are important questions. But one thing we're coming up towards the end of the show, and one thing that I was curious about based on something you were saying, Richard, is okay, so we've all three acknowledged that mental health is important and that maybe therapy is important, but what role does the doctor play? Like, does the doctor have any moral, and I have my own opinions, I'll save them, but does the doctor have any moral responsibility to say, no, I want you to kind of think about this first before doing such a dramatic surgery? I mean, presuming it's that dramatic. Or to just tell a person, "No, I won't do that surgery because it's not healthy for your body." And one of the examples I'll give is I was watching a documentary where a woman already had substantially large breasts, and she was very, addicted to plastic surgery, and she wanted to get her breasts, um, enlarged to a size that her surgeon thought was unhealthy. Like, he's like, I cannot make your breasts that big, like, it's not safe, it's not healthy. You're gonna experience significant problems, and I just won't do it, right? And that's kind of an extreme example, so you can back it up to wherever you think is appropriate, but what do you guys think in terms of the doctor's responsibility to ensure things like, stable mental health before surgery, or, "No, I'm gonna draw the line for health reasons, and I won't do this for you."
Well, despite what you see here, I have not actually had any cosmetic surgery, so have a hard time saying exactly what the procedure is for a doctor. I don't know if they already have to take into account any mental health reasons for why they're going into surgery. My main source of reference was the show Nip Tuck, and I know that it
Oh,
wasn't
yeah, don't
realistic at all. There's a lot less murder in real life. Uh, well, maybe. So if there is no procedure for it, I'd encourage there to be procedure and like a mental health ruling. Like, you don't necessarily need to go that in depth, but people should like like for trans healthcare, they have to go through therapists and like make sure that they're doing what's absolutely right for them before they even do any kind of transition. I would think the same thing should apply for just about anything. Maybe depending on how drastic the change is, because if you're really changing your body around, you want to make sure that you're making the right choice for you. You may absolutely. I'm not saying anything. I'm not saying don't pursue it, because it may be the right line that you should be pursuing for yourself. But I do think that having a mental health check and making sure that you're not pressured for it for unknown reasons that aren't going to make you
Yeah.
happy later on, or like some people, they think something's going to make them happy and then they realize the problem was elsewhere. So like a therapy analysis, I can't say the word, but it involves the word analyzing. So
Analysis.
Analyzing?
thank you. What happened to I had like a small stroke in my mouth.
It's just in your mouth, not in your brain.
Just that one word too. It's very specific. They would take that into account, and hopefully the doctors will do what's best for them. I do think mental health is important. I do think that affects how you see your physical body, because
Yeah.
I'm not an adonis or anything like that, but I don't have like any stigmas on my body. I have that gut, and I feel a little bit of a beer gut, and I'm feel like I make the trade of I want more beer. I'll let that
I'll take the
let that
gut.
keep growing. So like you can be okay with your flaws, but not everybody else needs to if they have the option to get out of it.
I think I think in Britain there probably is like a talk between a surgeon and a someone who wants to have augmentation done.
Mhm.
If it's from a purely cosmetic standpoint.
Right. Oh yeah, and just to be
Um,
clear, that's where the question is. Yeah, not for
yeah.
corrective stuff, but purely cosmetic. Yeah.
And I think yeah, I think the doctors have got an obligation to kind of talk it through with people to make sure it's the right decision for them.
And definitely you shouldn't have I see a lot of people online, especially like places like Reddit, where they feel like they're making the medical choice for people. Don't ever take the opinion of somebody that's you're meeting online who has had no uh idea of your medical history or your mental health history. Don't take people that read a paragraph and think they can diagnose you. Take the opinion of people that have gone to school for it, because everybody's likes to act like they're an expert online. I'm not an expert. If I tell you that you're good for your surgery, you should fucking ignore me. If I say you're not good for your surgery, you should fucking ignore me, because I'm an idiot with no qualification, and that's the most of what you're going to hear online.
Yeah, which is why people shouldn't be putting that kind of stuff online to begin with. Yeah,
Yeah.
I just went through that I was just diagnosed with carpal tunnel syndrome, which is a matter of it's a fancy way of saying you've overused your hand in a repetitive way and now you're going to pay for it, right? And I can't tell you out of the woodworks how many different people came up with different solutions that work for them or that, that they think is the solution. And I
Did you
think
try
that
any essential oils, Laura?
yeah, I've been
Sarcasm.
rubbing lavender oil on it, let me tell you. It works so well. No, alongside medical treatments. Um, no, I think when it comes to that, I think, oh, I lost your point. You were talking about medical opinions online. Yeah.
Yes.
So, um, I think it's very dangerous for people to put what they think that other people should do online, especially if they're already undergoing pressure, like not having good self-esteem or questioning their body positivity and stuff. I think it's really important for people to withhold those kinds of things and say things like, "Well, go talk to your doctor," right? Instead of, "Well, I got this really successful surgery and I recovered in this many weeks and it's no big deal, so you should go do it." But every single body is different. Every single person's mental health status is different. And that's why I'm with the two of you. I don't know if people get screenings before like cosmetic surgery, like elective cosmetic surgery that doesn't fix something like a burn or something. I think even in those situations, it's good to have the mental health screening of here's what it's gonna be like before, here's what's gonna be like after, here's a realistic expectation because surgery doesn't fix all problems. Um, I think back on the girl whose name I still can't remember is like Jean, it's something gray. I don't know, but
Jean
not the
Grey's an
X-Men girl.
X-Men.
Yeah, not the X-Men girl. I just have the word gray in my head as part of her name. But um is is your self-image better afterwards or not? Like to have that serious conversation with them that it might not happen, right? I think people have the tendency to think that if I make X happen, I will be happy, right? And so for me, with my tattoos, my piercings, I think I'm gonna get X tattoo and it's gonna make me happy. And I was absolutely right every single time. I love every body modification I have, and as soon as I retire and I'm able to get more, I'm going to love and enjoy those too. And so I think a lot of people can get a lot of positive out of cosmetic surgery, but to just at least have the conversation, I think, is valid and important.
Yeah,
And that
and I don't think the therapy, like you go through that and the therapist gets to say whether or not you get it. It's
no,
just how you come into realization whether it's good for you. Because I would still think it was wrong if like they started mandating that you go through
like get
therapy and then
signed off in order to
yeah,
get
and
it
then
done.
yeah, that would be too much, I think.
Yeah. If you have opinions on what we've said or your opinions on cosmetic surgery itself, go and join our Facebook fan discussion group and let us know what you think. We're accessible. You know, we've now got Josh on board. Throw all your stuff at him. Let him have a turn at answering you. And you know, yeah, it's been an interesting discussion. And as usual, we've gone down a few different rabbit holes we probably didn't expect to when we began. But in the meantime, we are Skeptic Hangout. So keep questioning.
Interrogate your beliefs.
Stay skeptical.
And we will see you next time.
Bye.